Hey everybody, it is Mama. Welcome to our weekly discussion of self-care and mental health. I have some wonderful guests today, and of course our wonderful ladies that we always work with are here with us, Miss Patty and Lindsey. So as I'm getting ready to bring them on, as always, like, share, give us those hearts, give us those likes, and then share it with your friends and family. And if you know somebody that is not on Facebook, they can go check out Rose Dynasty Foundation on YouTube, and they can watch it live and pre-recorded there. So let's go ahead and bring the girls on. Hello, my friends.
Hello.
Hi,
Milo's ready.
Hello, Milo. Milo decided to join us. Are we watching out the window as always?
Yes. Likely he's going to jump up on the desk, so let's just,
Oh, well, backstage when you were up, we were laughing because Milo was ready in the camera like, I'm going to take over. Lindsey's not working today. So awesome. Welcome. I'm going to go ahead and bring Michael on anyway because they're sitting right next to me. So let's welcome my friend Michael.
Hi.
Michael McIntire. What's up, y'all? Michael is an RN, and we'll talk a little bit more in a minute about everything. So how are y'all two doing? What's new? What's changed? Anything?
No.
Busy.
No changes.
No changes.
July is usually really slow,
Yes.
and that is not the case right now at all. So that's been a different type of environment to kind of like wrap your head around because honestly, I've been doing therapy now for 8 years, and statistically July is literally you could just take the whole month off and nobody would even know that you're gone.
Yeah.
And that is not the case right now.
And so many therapists are full.
Yeah.
They're having to recommend people to other people. And it's, of course, like we've been talking about this, it's the time, it's what we're going through, this whole mess. So, and I just want to say, of course, welcome all of our friends who join us weekly. And if you're joining us later, pre-recorded, thank you for joining. We've been doing this now, of course, I was leaving count like 15, 16 weeks. And we were trying to regularly do this. And what we decided to do is, COVID is obviously a big topic, a big conversation. And of course, we've had Crew Health on here. We've had several different types of guests. And I think it was really important. Michael and I worked together at Crew, and we were talking, and I'll let him tell a little bit about what he does, but he does work with COVID patients. And I just think it was a great opportunity to kind of have some conversation, and we'll kind of go from there. So tell us a little bit about yourself, who you are and what you do.
So my name is Michael McIntire. I am a registered nurse. I work locally in the Orlando area here at one of the major hospitals. So I've been a nurse for several years now and just recently stepped into the hospital world, was hired to be a neurostroke nurse, and was kind of thrust into the world of COVID just like the rest of us here. So kind of learning with it every day and
Going with the flow.
With the flow.
I think that's everybody's life right now. Like we think we're doing one thing and we kind of have had to ride the wave going every which way. So absolutely. So Patty and Lindsey, please feel free to jump in. Also, to let everybody know, whoever's watching, if you have questions, you want to comment, anything you want to talk about, whether it's mental health, anything like that, that's why we're here. We're here to answer questions.
Yes.
What do you think? Where should we start? What should we go with? What do we want to talk about?
What about
Oh.
Go ahead, Patty.
By all means, my dear.
Okay. A day in the life.
Yeah.
A day in the life. What does your day look like at the hospital?
So right now, it kind of changes from day to day. So I usually have 4 or 5 days off in between my stints of working at the hospital. So the first thing I usually do on day one, I go in, I see what's changed, what we're doing this week, because the rules change from day to day. It's like playing Monopoly with a toddler. It's you're going to get a different set of rules every time. So normally the first thing I do is I'm seeing how we're functioning and what's going on. And then, of course, I like to research, see what my patients are doing, what they've been through, kind of see what their journey has looked like. And from there, we get report. I gown up into all the gear, or as I like to call my Corona drag, and go and see all my patients, get a set of eyes on them, kind of assess what their needs are going to be from me for that day. And then we ride the wave for 3 days.
Now, are you, and I know we talked a little bit earlier, so you have a cycle where you're able to go in, check the patients, you're only spending so much time with them, limiting the amount of exposure, which we know is helps in the transmit and the, and moving of COVID. And of course you're able to derobe, do your work, whatever you need to do. And then of course, then rounds happen again.
Right. So if you get lucky, you're able to do it in the cycle. So you gown up, you put on everything, and then you go in and you see your patients back to back to back. Do everything you need to for the morning in that one visit, because you're trying to limit the amount of time you're spending in the room. So a lot of our visits with our patients, I'm doing outside of the room on like my portable phone, calling into their phone. How are you feeling? What can you do? That's a lot of my face-to-face is through a window, kind of like waving.
Mm-hmm.
And then,
do you feel like Dear Evan Hansen?
huh?
I said, do you feel like Dear Evan Hansen? No.
Yeah, I'm sure.
Go ahead. Broadway, guys, Broadway.
It completely went over.
Yeah, I only know because my friends are Broadway. I'm sorry. The Broadway people that watch, the gayer people than us, which are know that.
But so a lot of the times, like everything that I've been taught about nursing is, you're supposed to go see your patients regularly and you're supposed to be in there every hour doing your rounds. It's a little different than what we've done before. Our like hourly rounding is through the window, kind of peeking in. Are you okay? Do you need anything? So we're trying to limit how much we're actually seeing, and we're limiting how often we're in the room, not how much we're seeing. We're still seeing just as much as we would, just not in the same space.
Right. Which, I mean, from what we all know, like you had said, things change constantly. Things are shifting and we're finding new things. But I also like what you said. I mean, it's not that you're limiting your interaction with the people, you're limiting how you're interacting with them. And it's just keeping you safe and keeping others safe around you. I know that you had mentioned this earlier. We talked about this beforehand. You said that what you're noticing is, we talked about this yesterday. Sorry. Brain went 7 different ways. You were talking about when this first happened, we heard so much about ventilators. We heard so much it was like you're in your COVID, you're on ventilator. And one of the things you expressed to me is how things have kind of shifted.
Yes, there's actually been major shifts in the standards of care for patients that are COVID positive. So at the hospital before, like when this all first started, I mean, even down to our PPE has changed. In the first couple weeks of COVID, we were only supposed to be, we were told, nope, that surgical mask is enough. The same thing that you would wear to Target is enough to keep you safe. And they were going based on the research of the other forms of the coronavirus. Mm-hmm. So where droplet precautions and droplet transmission is the proven way that those are working, we're still learning. But in the beginning, when it came to respiratory distress, you went straight from nasal cannula to ventilator. There was no in between. And now, they're starting to see, well, let's try high flow oxygen. Let's try heated high flow oxygen. Let's try CPAP, BiPAP. They're adding more to the continuum before you get to ventilator.
Yeah.
And I know for me, that's good to hear, because we automatically think anybody that has COVID, that's the first thing you think of, because that's what media has shown, that they're automatically on this table and, with a ventilator going. What were you going to say, Patty?
I was going to say, because I know that we have focused on a lot of the fears that people have. Mm-hmm. Because there is so many different mixed messages. I've always considered myself like the science nerd and all of that. So I do still read a lot of medical literature, but maybe can you explain some of the variations of symptoms that you're seeing so people get a better understanding of kind of the more validity, I guess, of what is actually like people coming in with diagnosis of COVID, like what are you seeing?
Absolutely.
That aren't asymptomatic, because of course asymptomatic, we're not going to see the symptoms.
There's, you have your asymptomatic patients. They're going to be on one end of your continuum there. So your asymptomatic patients that show no symptoms whatsoever, they go about their daily life. Some patients I've spoken to, they just had a little bit of fatigue and a light cough. They just thought they had a little bit of allergies. And then you have some patients who come in, they're running the high fevers. They've got the chills, the muscle aches. Every patient's presenting differently. And the CDC has been adding more and more symptoms to what could be COVID. So like the ones that are the most common are going to be, those flu-like symptoms, the cough, the fever, the general fatigue, the body aches. Those are going to be your big ones. But a lot of people are experiencing shortness of breath where it feels like, someone's sitting in the middle of your chest. That's when we're seeing also, because it ends up becoming a type of pneumonia. Or I spoke with one patient who the only symptoms they had were some headaches. They came into the hospital because they thought they had a 4-day migraine. It ends up they had COVID.
Mm-hmm. Gotcha.
So everyone's presenting a little bit differently from what we're seeing.
And I think another thing that, again, I'm going just based because I have no medical training, literally none. But based off, we're talking about media portrayals and things like that. Age range. What are you really seeing in terms of the ages of your patients?
I have taken care of patients in their early 20s. I've taken care of patients in their 90s. I'm seeing across the board a mix of everything. So when people are saying, no, I'm fine because I'm young, that's absolutely not true. That's not an excuse to not wear your gear the way that you should be. So wearing the mask when you go out and things of that nature. Thank you.
Well, and now you just opened the door for the topic, the masks.
The mask.
The mask.
So
how should people wear them? When should they wear them? What kind should they wear? When shouldn't they wear them? I've got lots of questions.
So I'm going to go ahead and preface by saying everything that I am saying at this point is CDC guidelines and recommendations. So that, I don't want someone to say, well, that one nurse said. No, Everything I'm saying is CDC guidelines at this point. Your mask should be worn anytime you go out. And the CDC recommendation right now is for cloth masks if you are not a healthcare worker. So the mask, exactly that type of mask is exactly what's being spoken about. And your mask is so cute. I can't get over that.
That's amazing.
So they're saying to wear the mask anytime you go out, and the mask should not just your mouth, nose and mouth. So it should be covering the nose, the mouth, because the mask is not to protect you from getting the coronavirus. It is to protect if you are carrying it from giving it to someone else.
Right.
So the belief right now, and all research is showing that it is a droplet transmitted disease, meaning that if let's say I have corona, which I don't, tested negative twice.
Yes. So far, so good.
So if I were to have it and I were to cough or sneeze, I would be transmitting droplets into his general region, which those droplets could then land in his nose or mouth and then travel down to the lung, and that's where it starts. So the mask is to stop me from passing it off, and just like his mask would stop from giving it to me.
And I think, and maybe you can touch on this too. Of course, the biggest thing is it's just a piece of cloth, And I've said this, and tell me if what you've researched has said is right. I again would rather a 10% chance than a 90 to 100% chance of getting things.
Right, and anything is better than nothing. So let's say. I'm trying to think of a really good example here. There's a thing going around on Facebook. I'm sure that you all have seen it by now, and I'm sure a lot of people have seen it about if you're wearing pants versus not wearing pants.
Right.
And so if no one is wearing pants, pee's everywhere. If the person peeing is wearing pants, it doesn't go anywhere but on them. Whereas if both people are wearing pants, it goes nowhere. And it's kind of the same premise with the masks and the droplets.
Right. Now,
we did have, I don't know if it was last week or the week before, we did have a big discussion from the mental health point of view, where some people feel claustrophobic or feel like their oxygen is being affected. And we've talked about the videos that your oxygen's fine. Doctors, nurses wear them for hours on end. And those for sensory issues, we talked about finding different fabrics and different molds. Like I brought out a bunch of them of, I don't have the duck-billed one, but for some people with like sensory issues or autism and things like that. So we did have a big discussion about that, but it's good to hear someone who is on the front lines, saying, hey, these work, this is what we need to do. And I'm glad we did have that discussion that we do need them, to help protect our fellow person, but we can also adapt it just as long as we're making sure we're keeping that coverage there.
Right. And a lot of people, the claustrophobia is an absolutely real thing. And the standing recommendation right now is if you are unable to wear a mask for some reason or another, there are options in place, whether it be, having things delivered to your house or doing contactless curbside pickup. But the general consensus is to wear the mask, unfortunately. I mean, where I work now, when I first started, I didn't have to wear the mask because that corona wasn't really a thing yet.
Mm-hmm.
And now I'm wearing one 12 hours a day. Like, the only reason I grew my beard back is because of acne.
Mm-hmm. Yeah.
So
the maskne, as they're calling it. Yeah.
And your mask that you're wearing in the hospital is a lot different than this. You're not wearing stuff like this.
No.
Yeah, you're wearing the N95s. You're wearing.
Like these.
When I'm working with patients, I wear the full respirator.
Mm-hmm.
So it's like a Darth Vader mask. It's a lot of fun. Makes cool noises, like you sound like Darth. And
it's so much more, it's way uncomfortable compared to a piece of cloth.
It is. And then, of course, there's the surgical masks that are just like the cloth mask. They're to stop droplet from coming out.
And I think it's important. And, everyone, exactly. And people want to make it a political thing. And this isn't a political thing. This is about, and I've said it many times, it's about being, first and foremost, being a good neighbor.
Yeah.
And this isn't insurance. This is legit being a good neighbor, being courteous and cautious of yourself and the people around you.
Yeah.
And we talk about this a lot, and everybody has different opinions, but it's good. And like you said, we've talked about this earlier. You're taking things right from the CDC. This is what they recommend, and we talked about this even beforehand. Listen, I don't want to be the person making the decisions.
No,
I don't want to be the person. We talk about schools. We talk about mask wearing. We talk about political things, and we want to talk about people making the wrong decisions. And Lindsey, you said this: we're darned if we do and darned if we don't. Like, no matter whatever decision is made, somebody's going to get pissed off. Somebody's going to have something to say. And I think when it comes down to it is, and I will keep saying it, is about being a good neighbor, being polite, being courteous to the people around you, and understanding that importance. Is there anything else about masks you want to add that you think we should know?
So the popular misconception that I'm seeing is that, if you're wearing the mask, you don't have to distance. That is absolutely not true. The mask is not a substitute for social distancing. Keep that 6 feet between you and someone else. Going back to the being a good neighbor, there's, like a good neighbor, stay over there. And it's
just saying
what you should be doing. I mean, you really shouldn't be within 6 feet of anyone unless like it's someone you live with, work with on a regular basis. I mean, we're 18 inches from each other right now, but do as I say, not as I do.
We work in the same office. We're around each other 8-9 hours a day. It's definitely a little different with that, but
they're getting tested on a regular basis.
And we're getting tested. We're taking all those precautions. But I like that. What did you want? Either one of you wanted to add something to that?
Yeah, I wanted to know about. So for a lot of the arguments that I hear from people is that they have asthma or they have breathing issues or those concerns with wearing the masks. And from the health perspective, again, because I don't know, what as a therapist, what feedback should I be giving in those situations? I mean, usually what I say is you need to talk to your doctor, you need to talk to your pulmonologist or whoever's in charge of your medical health. That's who you need to talk to, because again, I don't have a clue. But is there anything that we as the layman could be giving as feedback for the guidelines?
A lot of people, there's a lot of misconceptions. You're breathing in your own carbon dioxide, things of that nature, which is not true. Right. I mean, we even did it at work the other day with one of the pulse oximeters that tells you your bodily oxygen levels with masks on. You stay where you're supposed to be. You're not seeing really any changes in oxygen levels. Or a lot of the problems that we see is someone who kind of starts to freak out a little because there's something on their face, which that's not pleasant. I'll give them that.
Yeah.
But there's really no contraindication to wearing the mask. And like I said a little bit ago, if there is a reason that you cannot wear one, the mask is not for you, it's for other people. So you should be using services like, curbside and things of that nature, because the mask is preventing you from giving the disease to someone else.
What about the face shields? Because I know we had kind of talked a little bit about that in one of the other, when we were talking about masks. And, I know one of the theme parks has said, like, if you can't wear a mask due to disability or things like that, they're providing face shields. Are those an okay alternative?
They're okay. I mean, if you have a face shield on, or you sneeze or you cough, you're spitting that all over your face shield. So it's some is better than nothing. It's not going to catch everything as something that were completely on your face would, but it's still catching some of it. It's kind of, like a sneeze guard at a salad bar for your face.
We don't have salad bars anymore.
Is there anyone here young enough to not remember a salad bar?
Ruby Tuesday still has one.
You?
Ruby Tuesdays.
Really?
Yeah, I guess they still do. Yeah.
I mean, they did. I don't know if they will now.
Or a buffet, sneeze guard at a buffet.
Yeah.
I'm saying now, COVID passed. There's no such
Yeah, no, there's not.
I hope there ain't. Lord.
And I would say, and I don't know what you want to share, so feel free to be like, not going there, that's fine. But I mean, I think that as a counselor, I would be dismissive if I didn't say, since you are in these high stress moments, that all these things are going on, do you practice self-care?
Oh.
Ooh.
Jason can tell you how I am about that.
Yeah.
Oh, yeah.
Right now, my idea of self-care is probably not the best one. My self-care has been, hot bath on occasion, but the hot bath is synonymous with sitting in a tub of water with a bottle of dark red wine. Mm-hmm. So, good and bads. Mm-hmm. But I mean, I do a lot of online shopping, which is not the best self-care, but I need to work on it a little bit. So between both jobs and everything else, I do need to take a seat somewhere. And
we'll talk more about that, because I'm learning too. But I mean, that's still, and we've talked about this, self-care. That's still a form of self-care. Mm-hmm. That hot bath, even or 2 bottles of wine or whatever, or shock therapy, whatever.
And I know I work with healthcare providers, and I'm a big advocate on self-care and coping skills. And I do see that's that spot where, you can neglect yourself really easy, because it's boom, 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 boom. You're in this high speed world, but it is so imperative, to take that moment. Like I always tell people, no matter how busy you are, there's at least 20 minutes a day that you can take for yourself. And that's when you're doing your daily constitutional, because you can't go nowhere.
If you don't know what the daily constitutional is, it's on the toilet or
when
the phone or the poo.
Mm-hmm. So you could read a book, you can watch Netflix, you can talk to a friend if they're comfortable with that.
The outhouse. I love my Tennessee people that are watching. But yeah, I agree. Lana, I will come to that question in just a second, because I think that's a good question. But on that self-care moment, I want to ask, are you seeing amongst your peers, mental health is important, and you have frontline people that you work with. Are you noticing that it does really become taxing? It's really...
Well, I will say that the hospital I work for has been very, very good to us in the way that they're kind of treating us and what they're doing. I mean, because seeing COVID day in, day out, it does a lot. It takes a lot out of you. If you're having to, put on the 19 layers of garb just to go into a room. Mm-hmm. So they're doing really good about, rotating us out to where we're working on other units, to where we can still kind of do like a regular day to day, as opposed to doing COVID all day long. And I will commend them. They've even set up like relaxation room for us, where there's like recliners and essential oils going, and somewhere to take a nice break. There's stretch areas. So they're doing really, really good about giving us frontline employees and just everyone working in the hospital, because you don't have to be working on a COVID floor to be dealing with the stress of COVID.
Right.
Every patient that comes in is afraid, and you're having to kind of alleviate that. So I am seeing it being a little bit more taxing to the staff, and we're trying to bring a little bit more self-care in. And
good. I mean, the relaxation rooms are important. The stretch rooms, that's completely, absolutely important. I want to touch this really quick. If I'm saying it, Lana, wrong. If I'm saying it wrong, I'm sorry. Is there a tip for if you're caring for someone with the virus at home?
So if you're caring for someone at home with it, it's a lot of the rules as if you're going to Target. I hate to say it like that, but it's, maintaining the 6 feet, wearing the cloth mask. If you're going into the room with them, asking them to put the mask on to protect from passing on to you. It's going to be a lot of the general rules just to kind of keep from passing it along. And of course, those caregivers and everyone else in that house needs to be monitoring, and they should be probably quarantining with the person. So checking temperatures every day and keeping a track of symptoms and being very quick to call your doctor if you're seeing anything out of the norm. And also need to be aware when to seek emergency care for the person who is infected. So there are going to be times when, going to the urgent care is not going to be enough and they're not going to be able to help you. So you need to know when those things are. So if you're noticing that they're having increased difficulty breathing or trouble breathing, pain or pressure in the chest that they weren't having before, new onset of confusion. So if you have a family member that all of a sudden doesn't recognize or they're not able to say where they're at, they could be experiencing some new onset confusing, and that could be secondary to an oxygen loss. Inability to stay awake or inability to wake someone up is going to be another sign that they're not getting the oxygen that they need. And of course, the biggest one is, look at someone's nail beds. They should be pink. They should be,
not blue.
Not blue.
When they turn blue or you see some blueness in the lips or on the tongue, you should probably look at getting emergency care for your loved one.
Great advice. Most of that I haven't even thought of.
Yeah.
And I'll throw this out here because I'm willing to share. Like my husband and I work from home. I've been doing telehealth since all of this came out. My son, however, does work outside the home. And although, I monitor symptoms and things like that, he wears a mask when he works. Anytime he leaves his room, he also wears a mask because I do know of asymptomatic, people couldn't be a thing. What are your thoughts on that? Is that too precautionary? Is that pretty on par?
There's no such thing as too cautious. And quite honestly, if wearing the mask when, someone comes out of their room, it's a consideration to the rest of the family, just because if he's out there working with the public, you don't know what he's exposed to. He doesn't know what he's exposed to. Yep. So someone can be asymptomatic for up to 14 days and still be passing this along. Mm-hmm. That's not a bad idea at all.
Okay. And I share that because I've talked about my son before. My son is on the spectrum and he wears a mask for the 7-8 hours he's at work. He wears a mask when he exits his room. We spray his room in the area in his bathroom and all of that throughout the day. And I share that for those because I know a lot of the parents out there are concerned, and I know everybody's different, but my son is the atypical brain, but he's gotten used to it. And, just through some of my life experiences, that's kind of how we've handled it at home. So if you yourself are working from home, but have someone outside, taking that precaution can sometimes make a household feel a little bit more secure.
Mm-hmm. And thank you for reassuring that I'm not as crazy as I thought I was for being over cautious. Listen,
I told you weren't.
I know. I know you told me what. Listen, you should see me. I'm like, I've got hand sanitizers. I've got so much stuff. I'm in here cleaning, and I was that way at the salon. And we work in a medical office now, so it's even more. So it's good to know. I think it's reassuring to know. I mean, you have to have that balance, but I do like what you said. It's not going to be too over precautious to do that, especially if your son's willing to, and they understand. I mean, let's look at it. 90% of the people really do realize what's going on and realize the severity and the importance of this.
I have
other 10% is
I have questions about testing.
Ooh.
Okay.
Ooh.
So again, we've heard the Facebook stories and news stories and all this stuff about how one test is more effective than the other test, or if you do the rapid testing, you can get like false positives or false negatives, which should be like a pregnancy test. So what is the best how, who, what, where, when, why testing? Go.
So I'm just going to go on saying first, I mean, you can get a false positive or a false negative with anything. I mean, I've seen people 9 months pregnant pee on the stick and it comes back negative. So it's a tumor. But no testing is perfect. And just like the testing for the COVID-19 virus, and just like every set of rules and every set of anything, it's changing. So like the ones that we use at the hospital are going to be that nasopharyngeal. And for those of you who don't know what that means, it means I start at your nose and I go back into your throat with a swab. It's not fun.
No.
Those are usually the ones that I have the most experience with personally. I haven't used the rapid or anything with anyone, so I can't really speak to one better than the other. I can only speak to, the one where you spit in a cup is going to be more comfortable than the one that I know how to do.
Right.
And how quickly are you seeing results coming back? Because I know that has also been a big concern for a lot of people.
So it's going to vary. So like if some people, they get the rapid, it's 10, 15 minutes. They get a result on a rapid. And then some people, we're doing them at the hospital. We're sending them to our lab. We're seeing them in 12 to 24 hours because we're processing them ourselves. And then there's some where they have to be sent out to an outside lab. And those can be those 7 to 14 days, if not longer, based on the lab's turnaround and their caseload at that time.
Yeah. And I guess not to bombard you with questions, but that's why we have you on, is I know a lot of people
I've got answers. Let's go.
I know a lot of people are like, well, last week this was what it was, and this week it was that, and last month it was this. I've always, of course, I'm not a MD or a DO, so I always refer back to the CDC. And I guess so that we can have a medical professional, can you explain what novel means? Do you get what I'm saying?
I do, and I'm trying to think of.
Because here, I guess I'll give you a preface of kind of how I explain to people and tell them to go to the CDC and look it up in the dictionary. Is there, because everyone thinks, I won't say everybody, there's a lot of people that think that, well, this can't be true because it wasn't true last month, or next week's going to be something else. And that's where I think some of that disparaging information and anxiety also increases. So the way I kind of refer back to the CDC is that when we're referring to a novel virus, it is not like influenza that we are very familiar with. We know the treatment of, we know the symptoms of, there's vaccinations for. Smallpox, we've had a lot of information, where a novel virus is something that we have never seen. So it is very much trial and error, and things that would be done usually within a lab context over periods of years, doctors and nurses are having to figure out on the spot.
Right. And I mean, I can speak as someone who, like I said earlier in the show, the first thing that we do when we walk in after being off for a few days is seeing how the rules have changed. So like when all of this first started, we were told that the surgical mask is all you need. And then it became, you know what? Let's go ahead and wear the gowns. And then from that, it became, let's wear the face shields. Let's wear the N95 mask. So we're seeing new information coming out daily. And because there are other forms of coronavirus, just this strain, the COVID-19, we haven't seen anything like it before, where it's moving so quickly. It has the longer incubation time. We're kind of learning as we play. We're reading the rules as we go, and we're making them up as we go. So that's kind of where a lot of people are, well, I can't trust you because you told me this last week. And there's even day to day where things are changing.
Can I add? So as I have no medical background at all, and in my mind, that makes sense. I don't know. Maybe it's just because of the way I think. It would make sense. Obviously, this is something new we've never seen before, and we're learning as we go. So that confusion that I know several people personally that feel that same confusion. I don't understand that thought pattern because I know that this is something new. We've never seen it done before. And my common sense, I should say, would tell me that it takes time to learn. I mean, we don't know all the answers.
And that's where that novel term needs to be emphasized because, yes, even those SARS types have been around, they've also had time to study.
Right.
Where that novel means like this is brand new territory. Like back in March, I don't remember reading about blood clots. When it first came out, I only heard it was respiratory, and that was it.
Right.
Being someone who has asthma, that made my red flag go up. Oh crap. So that's why I wanted someone else to kind of speak about that little term novel actually means something really big.
And that's where we're seeing new signs and symptoms every day because the original symptom set was cough, fever, and shortness of breath. Right. And now it's fever, chills, cough, shortness of breath, fatigue, muscle and body aches, headaches, loss of smell or taste, which is a fairly new one in the last few weeks that came out. The sore throat, congestion, and the most recently added was nausea, vomiting, and diarrhea.
Right. I mean, I have a friend who tested positive, and that was their only symptom. They haven't been able to smell or taste anything for 2 weeks.
Mm-hmm. And a lot of people are presenting that way, where they're just kind of like, oh, nothing tastes good anymore. Oh, well, you might want to get tested. Mm-hmm. But the best way that I kind of tell people when they're saying, well, why is everything changing? I tell someone to go to the grocery store, pick out a board game they have never played before, take everything out, set it up, and then after every turn, read another page of the rule book. And realize we were doing this wrong. Let's reset this. Yep. And then do another turn with the rule you just read, read another page. And then you kind of see, oh, nope, this was wrong. This is how I'm supposed to be doing it. That's how every healthcare professional is feeling right now.
Yeah.
We're playing Monopoly with no clue what to do.
That's a good analogy.
Yeah.
Absolutely. Lindsay, what else do you want to ask?
Okay. So I work with kids. I work with little kids. And I know that is a big topic of conversation right now, especially with, schools reopening and things like that. Are the symptoms the same? Is testing the same? Give me the lowdown on the children, on the tiny human.
So I'm not a pediatric nurse. I don't play one on TV. I have never once. The only time I ever worked with pediatrics was when I actually did my clinical rotations. It's not my field. It's not my specialty, but there is research showing that children are not demonstrating the same type of symptoms. And that is dangerous because while they can carry, they can be throwing it around. You know how it is. A child goes to daycare, they come home, they're fine, but everyone else in the house ends up sick. Yep. That's my fear right now with coronavirus. And there's the clinical, I'm trying to think of the best way to say this. Right now, testing is kind of based on symptom. And if children aren't showing symptoms, there's really no justification to put them through the test because it's not enjoyable.
Yeah.
I'll be the first to say it. It's not fun. Yeah. So we're kind of like caught between that rock and a hard place there with, do we start testing children? Do we not? How do we? And that goes back to novel. We kind of don't know which page of the rule book we're going to go with on this one.
Right.
I mean, I know some counties in Florida are requiring children to be tested 2 weeks prior to going back to school, but that's a whole nother.
But like I said, I don't play a pediatric nurse, so I would be more than happy to get you those answers and kind of come back with them.
I think that would be helpful if you could share any of those resources, because I know that's when I'm not a parent, but at the same time, I love my kids that are my clients, and I can only imagine the concern and the confusion, because we are just keep hearing like the kids don't get it, or they get it, or they don't get it, or maybe they get it. We don't know. And so any information that you could provide would be great to share and to get out there, because they are, Seminole County is going back in 3 weeks. So.
And I will say, I don't know if it'll be helpful for you. But but again, science nerd here. Mayo Clinic and the CDC does have a list of symptoms, which from what I've read are different. Like children are developing like some swelling and rashes. Younger have Kawasaki's disease, but they're trying to still figure out the correlation. Again, there's that novel component. So a lot of the presentation is different than in not the tiny adults to adults. The presentation, some of the symptoms are very different. If they go to the Mayo Clinic or the CDC site, they can find that out.
I've got more questions.
Okay.
Okay. Hey, y'all, I came prepared just in case.
Oh, that's okay because not many people are chatting today for some reason, but that's all right. We got plenty of questions.
Okay, so I test positive for COVID. Now what do I do?
Quarantine.
Okay.
So the first thing you're going to do is you're going to quarantine, which a lot of people, I've kind of noticed there's some disparity in what quarantine actually means.
Yeah.
Lock yourself in your room.
Yeah. So don't go to Target.
Don't go to Target. Don't go to, I want to say Blockbuster, but that ain't been around for years. Like, I don't know what kind of, don't go to any place of business. Like, that's where you lock yourself down, you stay home, you monitor your symptoms. And there's also that's another thing that's changed multiple times in the last couple months. So at first it was 14 days, test again. And then, it was wait for the fever go away, then wait 7 days. And I believe the new one is 10 days from a positive result. So it's changed from day to day to day. So like on the inpatient world, what we're doing now is when we're sending patients home that have tested positive, we're sending them with a pulse oximeter, which is the cute little finger device that tells you what your oxygen level is, as well as a thermometer to monitor those symptoms and see kind of where you're sitting. And it's go sit down somewhere and monitor yourself is essentially what you do when you test positive. Mm-hmm. And then just follow CDC guidelines, because I wish I could say this is what you would do if you got tested positive next week. But it's changed so many times now. And I just tell people follow CDC guidelines for that time.
Mm-hmm. Okay, I have another one. Are all thermometers created equal?
Well, no.
I mean, that's, yeah.
The most accurate thermometer is going to be an under the tongue thermometer.
Okay.
I mean, the most accurate is going to be rectal, but who's doing that at home? Yeah. So, like, I love the point and shoot thermometer just for the sake of, cleanliness and hygiene. But I don't know how many people have, gone to Disney Springs or anything where they'll shoot 12 people in a row and they're all 97.3. Mm-hmm. So my personal opinion is going to be the under the tongue thermometer every time.
Okay. Hand sanitizer versus soap.
So
both.
If you're out and about and you have the hand sanitizer, go for it. If you have the chance to use soap and water with a good antibacterial soap, warm water, time and friction is gonna be your preferred, but either one is great.
What is your hand washing song?
Can we say that? Mm-hmm. Apparently there's Siri when it was on it over there.
I'll tell you off air.
Okay. But it's 20 seconds that you should really spend that time. That hasn't changed, or has that changed too?
That has not changed, but I usually tell people throw in a few extra seconds, use the alphabet.
Okay.
Now I know my ABCs. That's
help.
Okay.
Don't give me the COVID, please.
Mine's Jolene.
Not just this. It's got to be all around through the cracks. This doesn't work. Even with Purell, that doesn't work.
So what people with the Purell, you need to get your hands some people, they use a little tiny bit. And if you're going to use the Purell, your hand needs to be wet as if it was just in water.
Oh, okay.
And most people, I keep going the wrong way with my hands. I'm trying to get my hands on camera here.
I've been doing this for what, 10 weeks, 20 weeks? I still go the wrong way.
Yep.
So a lot of people too, the parts of your hands that you're really going to always miss, your thumbs, in between your fingers. And a lot of people don't get up under their nails. The amount of stuff that your nails hold is ugh. So what I tell everyone is, actually, we have hand sanitizer.
It should already be.
Did I break it?
It was already ready.
Did I
Mine's
break the hand
ready
sanitizer?
and loaded always.
So, get your hand sanitizer in there, get it really good and wet. You want to make sure you're getting your thumbs and getting up into your fingers. And you're always going to want to kind of do one of these. Get that sanitizer up under your nails to kind of kill what's ever living up in there. Oh, this is nasty.
It is.
Oh, this is that tequila hand sanitizer.
It is.
Okay, and then I heard a rumor, and this was a while ago. This was back probably April-ish, so again, things may have changed. But because people had been, washing their hands more, they were, getting the cracked skin and the dry skin and everything. And so then I heard someone say, like, you need to now make sure you're also moisturizing because the germs can then get into the cracked skin.
Yeah.
So I tell everyone I run across, find like a nice moisturizer. Like, it doesn't have to be expensive. It doesn't have to be, over the top, because we are washing our hands more as a society. And I can just say, as a healthcare provider that uses that really drying alcohol rub all day, every day, a good moisturizer, like, you don't have to moisturize every single time you wash your hands, just to, if anything, just for the comfort, because if it starts hurting, then people stop doing it.
Right.
And like, I can say, me personally, like, my hands start to get like scaly and gross. And like, when you start to get, they're called fissures, where you have little like cracks in the skin and things, you can start to have bacteria and such form and reproduce in those little areas.
Okay.
You got some good questions. Did you think of all these, or people asked you?
No, like, this is just me.
Okay, that's great.
I haven't had a chance to talk to a professional yet, so I was like, hey, if no one else is going to take this opportunity.
Nothing wrong with that. I really appreciate you coming on here and chatting with us.
Yes.
Did you have another question or two, or were you said yeah?
No, not yet. He
Okay.
said keywords, and then my brain like gets triggered. So maybe, but not yet.
Okay. We're going to give a couple more minutes for anybody that's watching. If you want to throw up a question, please do. We talk about mental health, and we kind of touched on it again earlier. Do you, as in the area that you work in, do you come in contact with I keep saying clients from all my years of doing hair, of patients, family members? Are you seeing anything like that interaction? I mean, I know they can't go in the room, but I don't know, like, if there's the window waving, stuff like that. If you're seeing.
So every hospital is going to be doing things a little differently. I can only speak to where I'm working, and on our units, where we are housing. Oh my goodness, you can tell I worked in corrections. Where we do have COVID positive patients, we are not allowing family members. So a lot of their communication, I mean, a lot of people are like, oh, what's the number into the room? I'm recommending, like, do a FaceTime, do a Facebook video chat, like, just to kind of get that face-to-face interaction, because that takes its toll a lot more than a lot of things. And seeing someone and seeing, it's not all ventilators and DNRs, and kind of seeing that does put the family at ease a bit more. It kind of helps to make it an easier process for the whole family, not just my patient in their bed.
Good. I like to hear that. I just lost the train of thought what I was going to ask. I don't know where that was.
I have a question now.
Yeah.
Okay. If you have a client, if you have a patient who has special needs, so say like autism or a handicap or a disability, are they allowed a family member at that point, or they're still not allowed?
So we're approaching it on a case-by-case basis. So if we do have someone, with a spectrum disorder or something that would require a family member, it's being approached case by case. And we have had cases where the family is allowed. Okay. And the thought process behind that also is, not only are they going to help the patient, but odds are they live in a close proximity. They're caring for them in a close proximity. They've probably been exposed already. So we're not really stopping anything from happening.
Right. Okay. I don't have anything else yet.
I really wish I could remember that question that I was going to ask. It was going to be about oh my goodness.
Well, we were talking about them being able to do like a FaceTime.
Hey, where was I going with that? I'll think of it when I walk it to my car and get in. I'll be like, what was that? So absolutely. Any other questions? Patty, you have anything you want to throw in?
No.
Everybody, we've had quite a few people watching. I think people are just gathering information, and thank you, Lana. Oh, there we go. Someone would need to bring me yarn.
We actually do allow family members. So if there is something, I need my iPad, or we are allowing them to be delivered. So let's put that at ease for you also, Lana.
I know we're like, I'm not familiar with you. So I'm like, oh, I want to know, is it, you can't tell me.
She could.
How would you explain it? Is it Lana or Lena?
Is it a hard A or a soft A?
There we go. La or A? I want to know. That's going to be my question for the day. That's probably what I was thinking a while ago. I don't know. That's driving me crazy. Oh, she said, thank you. There's just no format with this. We just got to go with it. I have a feeling she's going to answer here in a second, but that was driving me crazy. We were talking about that. I was asking about that. Yeah, I don't know.
It'll come to you like at 2:00 in the morning.
Yeah, I'll just shoot you a text and you'll be like, why are you texting me at 2:00 in the morning?
No, I'll wake up and I'll answer it because, I'm a nice lady.
Patty and I, we all we'll chat at random times of the night.
Yep.
Anyway, so, I don't know that person. Is that a celebrity? Lana Turner. Is that how you, okay.
Lana Turner.
Okay. That answers your question then.
There we go.
I'm from the South, and we don't know how to talk sometimes, so All right, but as always, you two, do you have something you want to close with?
I just would say that I know, a lot of people, you're feeling like things are humdrum, they're monotonous, anxieties are high. Just like we've talked about in here, make sure you're taking care of yourself. Frontline workers, nurses, doctors, counselors, parents, kiddos, any essential workers, basically everybody and anybody. I say it every week, and I know you probably get tired of it, but practice that patience and kindness with yourself. Give yourself that little bit of time just to catch your breath, literally and metaphorically. Jason has said it time and time again. We are in unprecedented historical times. So we don't always know what's right or wrong, but I can tell you if you're doing something for you, then it's right. As long as it's healthy, gotta be healthy, then you're doing the right thing by taking that time for yourself. So, hopefully some of these things have given you better answers instead of the wishy-washiness that we've talked about social media and media can portray, giving you some more of that concrete validity of someone who's actually there in the pit of it. But at the end of the day, all of us need to take time for ourselves.
Absolutely. Lindsay?
Check in on your people.
Yeah.
I think we've had some rough times, and some people aren't responding and they're not coping well. And unfortunately, we have had a lot higher rate of suicides. So check on your friends, check on your family members. You never know when that random text of, hey, I've been thinking about you, how are you doing, is going to really, really be that moment that can really change some things out. So just check on each other, love each other, be kind to one another, be, empathetic, compassionate. And if you need a break from people, I can't even tell you, Mark Zuckerberg, that pause button, that mute button, that unfollow button, thank you.
Mm-hmm.
Or even unfriend button.
Yeah, we practice what we preach.
Yeah.
Mama, me, and Lindsay, we talk a lot, y'all, behind when this isn't going on. We, checking on your people. So we don't tell you to do stuff we don't do ourselves.
Yeah.
And it's hard. It's hard for all of us. It's hard for our personalities. It's hard as therapists. Like we even talked earlier, sometimes you had to say, you know, I'm full. I can't take another client. Let's find someone that can help you. Chrissy says, thank you, Patty. You needed that today. Hi, Chrissy. I love you.
Good. I'm glad.
All right. Did you want to have anything to say to close?
I'm going to take the very clinical approach to this and say, wear your masks.
Yay!
Wear your masks.
If not for yourself, for someone else.
Too.
Oh, yeah, wear it. I'm smiling.
Yes.
I love it. I love it. And I'm going to close today as always. Don't ever forget your love, accepted, and wanted. Also, don't forget story time at 2:00. I will be live this week. And yeah, we'll see everybody soon. Love you all. Have a great day. We'll see you soon.
Bye.
Bye.